welcome to Hashimoto's Unfiltered, real talk, real solutions. The podcast where we cut through the noise and get straight to the heart of living with Hashimoto's. My name is Dr. Ray Benedetto, your host, and I'm here to share my expertise, personal insights, and from time to time, conversations with incredible guests to help you take control of your health. Together, we'll explore actionable items, debunk myths, and navigate the complexities of your thyroid health. So whether you're newly diagnosed or a seasoned warrior, this is your space for unfiltered truth and real hope. Let's dive in. Today's topic is how to basically stop getting dismissed or gaslit, if you will, the term nowadays, which I think is appropriate. It may be a little harsher than dismissed, but I think it's appropriate by your doctor in regards to your symptoms or your diagnosis or what have you. And it's kind of a shameless plug. Most of you have probably already seen too. I'm doing a workshop on this on next Wednesday. And we're going to do a deep dive on this. I'm going to spend like 5-10 minutes on it today. We're going to spend like 45 minutes to an hour on it on this workshop as far as like diagnosing it, breaking it down, unpacking it, giving you actionable strategies on what to do about it. We're going to do like a little Cliff Notes version today, but the real meat and potatoes is next week. So if you want to join that, let me know. I'll drop a link below this recording. Yeah. So listen, I've been doing this a long time and I talk to you guys all the time and I've seen so many patients with this. I've talked to so many people and done so many consultations and email and messaging and social media messaging and all this kind of stuff. And I get it. And even, my story, my origin story in this as well with my wife, when she became symptomatic and we diagnosed with her, we had to do it. I had to do it. There was zero help from the medical community when it comes to Hashimoto's autoimmune thyroid. So I talk to you guys all the time and I get it. I get how absolutely frustrating it is, like beyond frustrating, like maddeningly frustrating, if that's a word. Did I say that? It's maddening, maddeningly frustrating when you go to your doctor or doctors, primary care docs, endocrinologists, I don't care who it is, and over and over and over and over and over again with the same symptoms, fatigue, hair loss, weight gain, brain fog, like stuff that's not normal. You're like, something's going on here. And that's how the story plays out. You go to your doctor, you usually start with your primary care. They run some blood work, and maybe somewhere in that blood work is a simple TSH screening. So it's like all they start with is TSH screening. And let's say hypothetically that's normal. When I say normal for them, that means in range. So it's in the lab range, which is gigantic. It can be like anywhere from 0.5 to 4.5, sometimes 5. Huge range. And as long as you're in that lab range, you could be 0.6, you could be, 4.99 if the upper limit is 5. You're in that range, nothing is wrong. And so it's not your thyroid. So they tell you it's not your thyroid. You don't know any different. So you're like, well, they're the doctor. They must know what they're doing. And they send you on your way. And the symptoms don't go away. And weeks go by and months go by and years go by. And we're wasting time and we're not well and we're losing life. And that's how that goes on as a broken record. Maybe that first time, or maybe some other time down the road, that could be 5 months, 5 years, or decades down the road. Maybe they run that TSH screen and it's out of range. Maybe it is high. Maybe it's like 8 instead of like the upper limit's 5, and it's like, oh, it's 8. It's out of range. High TSH will indicate hypothyroidism, underactive thyroid. So what's the solution then? Oh, you got hypothyroidism. And so here's your levothyroxine, here's your Synthroid, here's your Armor, here's your whatever. And that is thyroid medication, thyroid hormone medication. So they're giving you thyroid hormones because your thyroid's not making them. Not why is your thyroid not making them, just that it's not making them, so here they are. And that's going to manipulate the labs. That's going to make the TSH come down. That's the way it works because the TSH is based on the level of thyroid hormone in your blood. So when it's low, the TSH goes high. When they give you the medication, the thyroid hormone comes up in the blood, the TSH goes back into range. but you don't get any better. I have this conversation all the time. I just had a new patient start this morning, and that's the story. We met a couple of days ago. It's like, that's exactly how the story played out. 15 years ago, TSH went high. Here's your levothyroxine. Levels are in range. And he's like, since that day, I've never felt any better. Like, I've never felt any relief. My numbers are in range. I'm taking my medication. Nothing has ever changed. If anything, I'm just getting worse over time. Like, now I got like all this. I'm starting to see cognitive stuff. Like, I can't remember things. Like, I'm starting to see new stuff even pop up. So that doesn't fix anything. So that's how that story plays out. And if your TSH is in range in the first place, you're getting dismissed. Like, it's not your thyroid. Kick the can, pass the buck. It's something else. It's menopause. It's stress. You're a new mom. It's your job. It's whatever. It's depression. It's fibromyalgia. That it's just going to be completely dismissed as something else. So if you do get diagnosed and put on the medication, once your TSH is in range, that's where it ends. We're done. Maybe somewhere along the way, you got a referral to an endocrinologist, and maybe they did run more testing. Maybe they did look for Hashimoto's and they diagnosed it. They still are not doing anything about it, even though it's the cause of the hypothyroidism in the first place, is the autoimmune disease. So they may even check for it and they may even diagnose it, but they're not doing anything about it. They're just going to still say it's not your thyroid. You are taking your levothyroxine. Your numbers are in range. That's all that's ever going to happen in Western allopathic mainstream medicine. That is the only thing you're ever going to get from them. That's it. That story I just played out one way or another is it. And whether your TSH is in range or it's been out of range and you've been diagnosed and you're being treated, quote, for hypothyroidism with the meds, either way, if you're not diagnosed and your numbers are in range, or you are diagnosed and your numbers are in range, that's it. That's where it ends. Anything else symptom-wise that you have, that you keep going, and nothing changes, nothing gets better. Like, the fatigue doesn't get better. Maybe it does very temporarily when you start taking the meds, because you get this spike in thyroid hormone. But once that wears off, nothing gets better. I'm not losing any weight that I gained abnormally for no reason. If anything, I'm continuing to gain it. My fatigue is not improved. My hair is still coming out in clumps. My brain still doesn't work. Like, I got brain fog all over the place. My skin, my hair, everything stinks. Like, my dry skin, like everything. I'm depressed all the time. Nothing is getting better. So you keep going back. And they keep saying it's not your thyroid. It's not your thyroid. Okay. If you haven't been diagnosed with Hashimoto's, they're not going to check you. If you have been diagnosed with Hashimoto's, they're ignoring it. So how do we end this cycle? How do we stop this? Well, a couple things. Number one, and again, that's why I do these, and that's why I bang this drum so hard, is you have to advocate for yourself. So, and again, until you hear me say this, or until you listen to me, these recordings, and join my Facebook groups and get my emails, like, until you see that or hear that stuff, you don't know any different. But you're hearing the sound of my voice right now, so you know different. So you have to advocate for yourself, because they're not going to. So that story I just played out, that's as far as it's going to go. So if you're expecting more from them, it's never going to happen. So just don't expect anything more than that from them, because that's all you're ever going to get from the medical world. So you have to start taking the bull by the horns. If you've been diagnosed with Hashimoto's already, they're not going to do anything about it. Guess what? You do. You have to do something about it. We have an autoimmune disease now that is causing this. It's causing everything. And you know about it, and they're not going to do anything about it. They're just going to keep kicking the can and dismissing all the symptoms that are coming from it to something else. They're going to completely ignore it. And every time you come back with it, they're going to be like, no, it's not that, or we don't treat that. So they have nothing for you. So then you have to do something for you. So you have to say, okay, well, I've been diagnosed with Hashimoto's. I now know they're not going to do anything to treat it. And the only way I'm going to get better is if I take the bull by the horns here. And I got to figure out what my root causes are. And I have to make some dietary changes and maybe take some nutritional supplements, and and I have to find a provider. It doesn't have to be me, but someone like me who's like, oh, this person knows what they're doing. They specialize in Hashimoto's. I'm going to go see that guy or that gal, and I'm going to have them help me figure this out and get me better. That's what you have to do if you want to get better. Again, if you have not been diagnosed, so again, that story I just played out with all the symptoms and TSH is normal or TSH is abnormal, and you've been diagnosed as hypothyroid, but you've never been checked for Hashimoto's, that is step number one. It's the first and last step. That must be done like tomorrow. So you have to get checked for Hashimoto's, because if you haven't been and you have all those symptoms or you have hypothyroidism, it's probably Hashimoto's. Now you need to get checked like tomorrow. And there's simple blood tests. There's antibody blood tests, and they can be done very easily. You can kindly ask your doctor to run them. That's kind of my first line of defense. I've talked about this on previous live streams. You can ask your doctor to kindly run them. Don't take no for an answer. I have some scripting, all kinds of cool handouts and stuff like that I'm going to give on the workshop next week. It's just too much to go into today. But ask them nicely. I don't take no for an answer. You can order them yourself. There's plenty of online sites. I tell people, just shoot me a message. I will order them for you. You can get them for pennies on the dollar. They're not expensive tests if you have to pay out of pocket. But get them done. Get them done, and get them done like tomorrow, because you need to figure out if that's it. And then if that's it, great. We can move on. There's nutritional deficiencies. Honestly, maybe you don't have a thyroid problem. Maybe you don't. That's possible. Maybe you don't have a thyroid problem, but you have some kind of vitamin deficiency that's causing your symptoms. We need to figure that out. But unfortunately, your medical doctor, your primary care doctor, endocrinologist, whatever, it's just not on their radar screen. They're not going to do it. They're trained to run, they're robots. They're trained to run labs. They're trained to medicate based on those labs. That's it. They have zero training in functional medicine or lifestyle medicine or nutrition or supplements. Even if they have training in it, they don't practice it. They don't do it. They run labs. They treat symptoms with pills and treat labs with pills. Forget even treating the symptoms. They're just treating your TSH, a number on the paper, with levothyroxine or whatever else, fill in the blank. And that's it. They're not treating you. They're treating this number on a piece of paper. And if it's in range, there's nothing wrong with you. It's you. You're the crazy one. You're depressed. It's insane. It's insane. So the big take-home message today is take the bull by the horns. Medicine, your doctor is not going to do it for you. They are not. I'm telling you, they're not. And you know this. You just didn't know there was anywhere else to go, because you're just like, well, geez, I guess I'm stuck. I guess I'm up the river without a paddle. Until you found this group, hopefully. And then you realize, no, there's lots of things to do, but you have to do it. So they're going, that situation I played out, you guys have probably all been through, most of you that are hearing me right now. And that's it. Like, that's going to be a broken record. And they're going to just keep kicking the can and referring you to different doctors and dismissing your symptoms because they don't have a solution for you. They don't have a treatment to treat the cause of those solutions or those symptoms. So the quickest thing you can do when you get dismissed or gaslit, if you will, by your doctor is use them, if necessary, to get the proper testing done. If you've had the proper testing done and they're dismissing you, leave them. Go somewhere else. Go find someone like myself. It can be me, that's fine, but go find someone else to help you and to get you figured out and to get you better, okay? That's number one. Use them if you need to, though. Like, if you need to get the labs run, make them run the labs to confirm it. If you don't know if you have it, have them send you for the labs and don't take no for an answer. And get the labs done. And then confirm it. And then we're dealing with a different animal, and then now we can get to work. So unfortunately, that's the solution, gang. Your doctor is dismissing your symptoms. Use them if need be to get an accurate diagnosis. And once we do that, leave them. I don't mean leave them like for everything. Like you need a doctor, like you need a primary care physician for other stuff. When it comes to thyroid, it's a totally new path now. Their path is going to be this and this only. And so kill them with kindness, get the testing done through them if you need to. But if you've already been diagnosed, they're going to continue dismissing your symptoms and chalking it up to something else. Don't believe them. If you and your gut, because I have these conversations all the time with people, if you and your gut are like, this is a thyroid problem, and then they come to me and I'm like, rattle off your symptoms. And they're like, yep, that's every symptom of hypothyroidism in the book, whether you're on medication or being, quote, treated or not. You got to go a different way. So I hope that was helpful for everyone today. Again, shameless plug, next Wednesday. I'm doing a deep dive on this. We're going to like A to Z on how to overcome all this, what questions to ask your doctor, what tests to ask for. I just don't have 45 minutes to 60 minutes to go into it today. So I set aside a whole separate workshop because this is probably one of the number one, it's a top 3 issue that I deal with my patients, and what everyone comes to me with is the incredible frustrations that they're not getting anywhere. And I'm like, you're not going to. Come on over here. Let's go down this other path and let's get this thing fixed. I want to thank you for tuning in to Hashimoto's Unfiltered, Real Talk, Real Solutions. Again, my name is Dr. Ray Benedetto, and I hope today's episode helped to give you the tools and the insights you need to take another step forward on your Hashimoto's journey. Don't forget to subscribe, leave a review, and share this episode if you think someone could benefit. You can also connect with me on Facebook at Dr. Ray Benedetto and on my website, drraybenedetto.com, for more resources and updates. Until next time, remember, you're not alone and real solutions are always within reach. Take care and be well.